So this is the largest annual conference for specialized plastic surgeons, specifically focused on aesthetics. The English name is ISAPS, which stands for the International Society of Aesthetic Plastic Surgery. This year, there will be participants from over 90 countries, and more than 1,000 specialized plastic surgeons will be attending the conference. There are 3 topics I was invited to speak on: facelifts, abdominoplasty, and breast surgery. The longest time allowed for each presentation is 7 minutes. In those 7 minutes, you have to condense everything down to just the essence, the very best parts. In fact, the presentations address gaps that no one else has solved, but we went in to address those. I should mention that the innovations I shared with you actually started about 4 years ago. It's about laser scanners. These days, probably everyone knows about them. With laser scanners, once you see the image of the abdomen, there are some lasers involved. That was the first topic I was invited to speak on. The second was about the perfect stand, which I have already presented. And this time, it's about nano-heal or ScarX, depending on the online name. But in academic terms, it's about how to make scars look better. Last year, I gave a presentation in Colombia about the large spider facelift. There was one thing that really stood out. How do you get the area around the eyebrows to achieve that effect? In our case, it's a surgery that also uses an endoscope. So I'm going to share how it works and how we can adjust it in different scenarios. For example, if you want to lift here, or you want to contour there, or make adjustments in a certain spot, there are different ways to do it. We'll teach all of this in our lecture. It's important to understand that with every centimeter that is anchored, you can adjust it up or down. For instance, if you encounter a crooked eyebrow or something like that and you want to adjust it, you can do so and it will hold in place. This is the charm of this method. The rate of sagging is lower than with many other techniques, otherwise it could get confusing. We've made a lot of progress, and we have a series with thousands of cases to show. Over 4 years, we've gathered data from more than 200 cases. In our 4 years, we've had 2,000 cases. That's why I say this is something we've dedicated ourselves to. And it's not just about the way we think or do things. We've invested the team's budget and various labs' resources into this research. If you look at it, we even have a dedicated research team of my own. My secretary sits down to enter data every day to make sure that every detail is thoroughly recorded. And we've been doing this for 4 years now.